Okay, each and every content of the femoral triangle is very important, boundary and content. So listen carefully, today's topic is very important. So femoral triangle, it is a triangular depression on the very front of the upper one third of the thigh below the inguinal ligament. Okay, and its apex is pointed downward. It is an inverted triangle. Apex is downward, base is formed by the inguinal ligament. See here, this is the location of the femoral triangle. Okay, so this is inguinal ligament which is attached at the anterior superior iliac spine and the pubic tubercle. And this is Sartorius muscle. Here is the Adductor Longus. These two muscles and inguinal ligament forming the triangle, boundaries of the triangle. And you can see the contents. This is femoral nerve. Here is femoral artery, femoral vein. Here is femoral canal, and within the canal lying the deep inguinal lymph node of Cloquet. Okay. So this is a schematic diagram of the femoral triangle. You can see the base is directed above. Okay. Apex is directed below. Apex is formed by joining of two medial and lateral boundaries. Lateral boundary is formed by the Sartorius. This muscle is Sartorius. Medial border of Sartorius is forming the lateral boundary, and medial border of the Adductor Longus is forming the medial boundary. Okay, and these two boundaries are joining here at the apex. So femoral triangle is a hollow area in the anterior thigh, and large neurovascular structures pass through this area and can be assessed relatively easily. Tomorrow you will see femoral triangle. So today you go home and read all these boundaries and contents. Okay. So large neurovascular structures pass through this area and can be assessed relatively easily. Thus it is an area of both anatomical importance and also clinical importance. Okay, if you have to collect arterial blood, you can collect from this femoral artery, or in very sick patients where veins are not prominent, you can collect venous blood from also the femoral vein. Okay, so that's why it is very, very important. Cardiac catheterization can also be done through the femoral artery. That's how all these structures are important. So these are the boundaries of the femoral triangle. Base is formed by the inguinal ligament. Apex, it is created by the meeting point of the medial edge of Adductor Longus. It will be Longus and Sartorius. Both medial border, you remember, medial boundary is formed by the medial border of the Adductor Longus, because Adductor Longus is forming the floor of the triangle. Okay, it is a part of the floor of the triangle. Floor is gutter shaped and muscular, and it is formed from lateral to medial side by these muscles: iliacus, tendon of the psoas major muscle, pectineus, and Adductor Longus. You remember these muscles forming the floor. Next we are going to roof. Roof of the femoral triangle is created by the fossa lata. Fossa lata is the deep fossa of the thigh, having the saphenous opening. There is an opening on the medial side of the thigh that is known as saphenous opening. Okay, great saphenous vein is passing through this opening and going to drain into the femoral vein. Okay, great saphenous vein is an important vein, important superficial vein, and femoral vein is an example of deep vein, and they are connected. They are connected with each other, and after piercing this deep fossa. See here this green colored portion, this pyramid like structure, this part is the femoral triangle and this part is the adductor canal. Okay, apex of the femoral triangle is leading into the adductor canal. Who is talking continuously? Those who don't want to do the class, get out from the class. Otherwise, I will leave. Okay, so see the contents here. Here is the femoral artery, femoral vein, laterally there is femoral nerve, and these are the muscles you can see. See here the muscles forming the floor of the triangle. See this yellow dotted line, these are representing the boundaries. Base is formed by the inguinal ligament, which is the lowermost point of the external oblique muscle. Inguinal ligament is formed by the external oblique muscle, lower downturned part of the external oblique. Okay. And here is the adductor longus, medial border of the adductor longus, medial boundary, and medial border of the sartorius, lateral boundary. Here is the apex. Okay. And here you can see the muscles forming the floor of the floor of the triangle. Iliacus, here this white colored one is the tendon of the psoas major. So these are together forming iliopsoas. Then here will be the pectineus and this part is the adductor longus. So all these four muscles are forming the floor. So borders, two borders are there, medial border and lateral border. Superior border is the base. So as this area is triangle, it has three borders. Superior border is the base formed by the inguinal ligament, a ligament that runs from anterior superior iliac spine to the pubic tubercle. Lateral border is formed by the medial border of the sartorius muscle, and medial border is formed by the medial border of the adductor longus muscle, and the rest of this muscle forms part of the floor of the triangle. Okay. Next, we are going to the structures present in the superficial fossa. The superficial fossa, which was forming the roof, overlying the roof, includes these structures. Superficial branches of femoral artery. Three superficial branches are there, you have to know. So, these three branches are located in the superficial fossa and they are accompanying veins. Upper part of the great saphenous vein, superficial inguinal lymph nodes, femoral branch of the genitofemoral nerve, and the branches of the ilioinguinal nerve. Okay. Inguinal lymph nodes is also important, very important question for your theory. In other class we will discuss those. Okay, inguinal lymph nodes. So the inguinal ligament, which acts as like the flexor retinaculum of the hand. It keeps the vessels, nerves and the muscles in position. Okay, so inguinal ligament here acts as the flexor retinaculum, supporting the contents of the femoral triangle during the flexion of the hip. Okay, very frequently done movement, flexion of the hip. So these next we are going to, so you have to first know the boundary, then the contents. So next we are going to the content. So primary contents of the femoral triangle are these three main: femoral artery and its branches, femoral vein and its tributaries, and femoral nerve. And these two, femoral artery and vein, these are enclosed by a thick sheath of fossa that is known as femoral sheath. But nerve is not included in the femoral sheath. Next, other contents are the deep inguinal lymph nodes, which are lying within femoral canal, which is a part of the femoral sheath, and lateral cutaneous nerve of the thigh, which is a direct branch from the lumbar plexus. Femoral nerve is also a branch of lumbar plexus, and this lateral cutaneous nerve of thigh is also a branch coming from the lumbar plexus. And other cutaneous nerve of the thigh, intermediate and medial cutaneous nerve of thigh, these are coming from the femoral nerve. Okay. So you remember like this. In addition to the above structures, femoral triangle also includes the femoral branch of genitofemoral nerve and fibrofatty tissue. So all these are content of the femoral triangle. Okay. Boundaries and contents you practice as a theory long question. Okay, this comes in your long question. So, and if marks is more, then you have to discuss each of the content in 2-3 lines. Okay. So, contents, now we will discuss in details the contents. So femoral triangle contains some of the major neurovascular structures of the lower limb. From lateral to medial, the contents are femoral nerve lying most laterally. It innervates the anterior compartment of the thigh and provides sensory branches for the leg and the foot. And next is the femoral artery, which is responsible for the majority of the arterial supply to the lower limb. Next is femoral vein. The great saphenous vein drains into the femoral vein within the femoral triangle. Next is the femoral canal, which is the medialmost compartment of the femoral sheath. A structure which contains the deep inguinal lymph node of Cloquet, and some fine vessels. The femoral artery, vein and canal are contained within a fascial compartment, and that is known as femoral sheath. Okay. So next we are going to discuss femoral sheath. This also comes as a long question. Discuss the femoral sheath, its contents. You practice a schematic diagram also for femoral triangle and also for femoral sheath. Very important, commonly given question for theory. So femoral sheath is a funnel-shaped fascial sheath enclosing the upper 3 to 4 centimeter of the femoral vessels. And the femoral sheath is split into 3 compartments by 2 anteroposterior septa. See here, this is the femoral sheath enclosing the artery and the vein. Here is the artery, this is vein, and this is femoral canal, and they are separated by thin septa. So lateral compartment includes the femoral artery and the femoral branch of genitofemoral nerve. Intermediate compartment includes the femoral vein, and medial compartment is small and called the femoral canal. Okay. So see here, this is the medialmost compartment, femoral canal, intermediate compartment containing the vein, and lateral compartment is containing the femoral artery. Next we will discuss the artery, vein and nerve in details. Okay. So femoral artery and its branches. Femoral artery traverses the femoral triangle from the midpoint of its base to the apex. All these structures are important, can be given in your OSPE. Femoral artery, which these are large structure, you will see in dissection. Okay. Femoral artery, femoral vein, femoral nerve, all these you will see. Great saphenous vein. Okay. And different branches of the femoral artery you will also see. And the muscles are forming the boundary, floor, all these can be given in your OSPE. So for each of the muscles you have to know those 4 points: origin, insertion, nerve supply and action. And for artery you have to know the branches, beginning, ending, like this. Okay. And veins you have to know the formation, where it is draining, tributaries, like this. For nerve also you have to know the branches, supplying area, root values, formation, all this you have to know for your OSPE. Okay. So femoral artery traverses the femoral triangle from the midpoint of its base to the apex, whole of the triangle in the middle. So the artery enters downward and medially, and in the base of the triangle it is located lateral to the femoral vein. This relation is important. Okay. Above, near the base, femoral artery is located laterally. Okay. And near the apex there is changing of the position, but at the apex it is located anterior to the vein, and after that the artery is going medial to the vein. Okay. So there is a crossing of this vessel, and the femoral artery gives 3 superficial branches. These are very frequently asked in your Viva and MCQ. Superficial branches are superficial epigastric, superficial circumflex iliac, superficial external pudendal. These are the 3 superficial branches of femoral artery. And 2 deep branches are there. Profunda Femoris and deep external pudendal artery. Profunda Femoris is the largest branch of the femoral artery. Okay, and from the Profunda Femoris, two important branches are arising: medial circumflex femoral artery and lateral circumflex femoral artery. Okay, those are taking part in formation of different anastomosis, cruciate anastomosis, trochanteric anastomosis, all this. Okay, anastomoses are important for your short note. So see here the formation of femoral sheath has been shown. So these are the abdominal muscles, anterior abdominal muscles. See, this is external oblique muscle. This lower end is forming the inguinal ligament. Deep to it internal oblique, then transversus abdominis, then fossa transversalis. And this fossa transversalis is pulled downward along with the artery to form the femoral sheath. Okay, and posterior wall of the femoral sheath is formed by the fossa iliaca. Fossa iliaca is the fossa covering the iliacus muscle, which is arising from the fossa, iliac fossa of the hip bone. Okay. So this is femoral sheath. You practice a schematic diagram like this for the femoral sheath. Okay. See, it is divided into three compartments. Lateralmost compartment is containing this femoral artery and femoral branch of genitofemoral nerve. Intermediate compartment is containing the femoral vein, and medialmost compartment is the smallest. It is also known as femoral canal, and its upper end is called the femoral ring, and this femoral canal is containing deep inguinal lymph nodes, that is also known as lymph node of Cloquet or Rosenmuller. Okay. See here schematic diagram. This is a cross section through the femoral sheath. Lateral compartment containing femoral artery and femoral branch of genitofemoral nerve. Intermediate compartment containing the vein, and the medialmost compartment, that is femoral canal, containing the lymph node of Cloquets and some lymphatic vessels. Okay. So this is view from front. This is transverse sectional view, and this is enlarged view of this femoral sheath. Okay, understood? So lymph node has been green, vein is blue, artery is red. Okay, this color coding is used for different drawings. You during the drawings you only use colored pencils. Okay, red for artery, vein for blue, fossa or sheath or lymphatics is green, muscle is brown. Okay, and nerve is yellow. So this color coding is used. You remember it. And for surface marking also you have to use all this colored chalk dust. For artery red, for vein blue, yellow for the nerve, and for others white. Okay. So these chalk dusts are used according to the structure. So you can remember the relations from lateral to medial is NAVL. Femoral nerve is most lateral. Then within the femoral sheath lies this femoral artery, femoral vein, and the emptiest space is the canal, femoral canal, and then the lymphatic channel. Lymphatic channel is great saphenous vein. Okay. Next, so we have discussed femoral artery in details. Next, we are going to femoral vein and its tributaries. So the femoral vein accompanies the femoral artery. Vein is posterior to the femoral artery near the apex and medial to it at the base of the femoral triangle. And it gets the great saphenous vein and profunda femoris vein and veins corresponding to the superficial branches of the femoral artery. Those three veins: superficial epigastric, superficial circumflex ilia, superficial external pudendal. Okay. So veins, you just know these tributaries and its extent. Next is the femoral nerve. Femoral nerve is located lateral to the femoral artery. Its branches are very frequently asked, nerves of the femoral nerve branches. So nerve is located lateral to the artery, outside the femoral sheath, and in a groove between the iliacus and psoas major. That is also important for identification during dissection. It is located between these two muscles. About 2.5 centimeter below the inguinal ligament, it divides into anterior and posterior divisions, and which enclose these two divisions passes the lateral circumflex femoral artery, which is a branch from the Profunda Femoris. The anterior division gives two cutaneous branches, intermediate and medial cutaneous nerve of the thigh, and the medial cutaneous nerve accompanies the lateral side of the artery, and near the apex of the triangle it crosses the front of the artery from lateral to medial side. Okay, that's how this is identification point of the medial cutaneous nerve of thigh. Near the apex of the triangle it is crossing the artery from lateral to medial. And the posterior division, it gives rise to a cutaneous nerve, that is saphenous nerve, which is the longest cutaneous nerve going up to the great toe. Okay, it goes downward along the lateral side of the artery, reaching up to the ball of great toe. Okay, next we are going to femoral canal. Femoral canal is the smallest anatomical compartment located in most medial part of the femoral sheath. It is approximately 1.3 centimeter long, and the opening to the femoral canal is located at its superior border, and it is known as the femoral ring. Okay, and the femoral ring is closed by a connective tissue layer that is known as femoral septum, and this septum is pierced by the lymphatic vessels exiting the canal, and Cloquet's node is a lymph node situated in the femoral canal. So see here, this is view from anterior aspect. This is transverse section along with the muscles. Without, this is view from below. Okay. Next is lateral cutaneous nerve of the thigh. It appears underneath the, we have discussed artery, vein, femoral sheath and its contents. Next we are going to the other contents of the femoral triangle. This is another content, lateral cutaneous nerve of thigh. It appears underneath the lateral border of the psoas major muscle above the iliac crest and runs downward and laterally across the iliac fossa in front of the iliacus muscle under cover of the iliac fossa. And it enters the thigh by passing below the lateral end of the inguinal canal ligament. Okay, and occasionally it goes through the inguinal ligament. It gives cutaneous innervation to the upper lateral aspect of the thigh. So you remember the entry point and the innervation. That is important. Next, going to deep inguinal lymph nodes. Deep inguinal lymph nodes are generally 3 in number and are located medial to the upper part of the femoral vein within the femoral canal. The lowest one of these 3 is situated below the junction of great saphenous vein and the femoral vein, and the middle one is located in the femoral canal, the gland of Cloquet and Muller, and the greatest one is lying in the over the femoral ring. Femoral ring is the upper opening of the femoral canal. Next, we are going to some clinical aspect. First is femoral pulse. You have to take pulse mainly from the radial artery, okay? And other pulses you have to also take in some patients. If you cannot palpate the radial pulse, then you have to palpate for proximal arteries. For upper limb, you have to go for brachial artery. If they are also not palpable, then go to axillary artery. Okay, and for lower limb, you can go to dorsalis pedis artery, then popliteal artery, then femoral artery. Okay, so femoral pulse. So femoral artery crosses. So you have to know the location where you have to palpate the pulse. So the femoral artery crosses exactly midway between the pubic symphysis and the anterior superior iliac spine, and just inferior to where the femoral artery crosses the inguinal ligament, it can be palpated to measure the femoral pulse. So this is the point, midpoint between the pubic symphysis and the anterior superior iliac spine. And the femoral artery crosses exactly midway between these two, which is known as the mid-inguinal point. Okay, this is not the midpoint of the inguinal ligament. This is mid-inguinal point. There is a difference between these two terms. Okay, midpoint of the inguinal ligament is midpoint between the anterior superior iliac spine and the pubic tubercle, and here it is pubic symphysis. Okay, so these two are different. At the mid-inguinal point, you have to palpate the femoral pulse. These are important for surface marking, mid-inguinal point, inguinal ligament, all these, okay. Next is access to the femoral artery. The location of femoral artery is easy to access because of its superficial location and within the femoral triangle, making it suitable for a range of clinical operations. One example for such a procedure is coronary angiography can be done through this route. In this, the femoral artery is catheterized with a long thin tube, and this tube is navigated up to external iliac artery, then common iliac artery, then aorta, abdominal aorta, thoracic aorta, then arch of aorta, then into the coronary vessels. Okay, in the ascending aorta, there is opening of the coronary sinuses. So, to view any wall thickening or blockages in the X-ray, a radio-opaque dye is injected into the coronary vessels through this catheter. Okay. So, this is an important clinical aspect, coronary angiogram. Okay. In the long question, you will be asked about this femoral triangle or femoral sheath, and then as a part of long question, this comes. Okay, why coronary angiogram is done through femoral artery? Because it is easily accessible. Explain why question. And femoral hernia is also it can come as a short note or part of the long question. So femoral hernia, what is hernia? This definition you will be asked during Viva surgery Viva, okay? So what is hernia? Hernia is defined as a condition in which part of an organ is displaced or protrudes through the wall of the cavity containing it, okay? In the case of femoral hernia, part of the bowel pushes into the femoral canal and underneath the inguinal ligament, and it creates a lump or bulge in the area of the femoral triangle and requires surgical intervention to treat. Okay, you have to reduce the hernia and you have to do some repair so that herniation cannot occur further. See here, this gut is herniating, entering through this femoral ring, then entering into femoral canal. Then it is passing through the saphenous opening and lying superficially. Okay, so this is the root of the femoral hernia, and this femoral hernia is more common in females because in females pelvis is wide and the ligaments are narrower. Okay, the lacunar ligament here, one triangular lacunar ligament is there. This is smaller in case of female. So femoral canal and femoral ring is wider in case of female. That's why there is high chance of femoral hernia in case of female. This is very, very important. Explain why question. Why femoral hernia is more common in females. Okay, you have understood the answer. And this is the schematic diagram of femoral triangle, inguinal ligament forming the base. Here is the adductor longus, and this is sartorius. Okay, and these are the muscles forming the floor: iliacus, psoas major, pectineus, adductor longus. Okay, these are the contents you can see from NAVL, from lateral to medial. So N is the femoral nerve, here is the artery, femoral vein, empty space is the femoral canal, and lymphatic channel will be there. Okay, and you can see this great saphenous vein is draining into the femoral vein, and here in the this light pink colored one, this is femoral sheath. It has three compartments: lateral compartment containing the artery, intermediate containing the vein, and here is the femoral canal within which Cloquet's lymph node is located. And you can see the lateral compartment also contains a nerve, femoral branch of genitofemoral nerve. And this femoral nerve, which is lying outside the femoral sheath, dividing into two divisions, anterior division, posterior division, and in between the two divisions passes this lateral circumflex femoral artery, which is branch of this profunda femoris. Profunda femoris is largest branch of the femoral artery. Okay, and see the branches from these two divisions. From the anterior division, two cutaneous branch. Okay, here is the medial cutaneous nerve of thigh, which is crossing the femoral artery from lateral to medial near the apex of the triangle. Okay, and here is the intermediate cutaneous nerve of thigh, and another is lateral cutaneous nerve of thigh. It is entering from on the lateral aspect of the triangle near the anterior superior iliac spine. Okay, and it is a direct branch from the lumbar plexus. So all these are content of the femoral femoral triangle, and here is another deep inguinal lymph node. This is one, and another is lying over the femoral ring, and first one is lying here at the junction between the femoral vein and the great saphenous vein. Okay, so these are the contents of the femoral triangle, and this diagram you remember carefully. You have to see all these structures in the dissection. And here arterial branches have been shown. Femoral artery, these are the three superficial branches: superficial external pudendal, superficial epigastric, superficial circumflex iliac. Okay, you see the direction. Epigastric, it is going towards the abdomen, and external pudendal going towards the genitalia, and here circumflex iliac going towards the iliac spine. Okay. Next we are going to deep branch. Deep branch is this deep external pudendal and the profunda femoris. Okay, and this profunda femoris is giving two branches: lateral circumflex femoral passing between two divisions of femoral nerve, and here is the medial circumflex femoral, and this profunda femoris itself continues downward and giving perforating branches. Okay, 3 to 4 perforating branches, and fifth perforating branch, fifth opening of the, and these opening perforating branches are piercing the adductor magnus muscle. Okay, and fifth opening is from the femoral artery itself. And you can see this lateral circumflex femoral artery again dividing into three branch: ascending, transverse, and descending. And this medial circumflex is also dividing into ascending and transverse branch. Okay, and these branches are taking part in formation of anastomosis. See here, iliac anastomosis is forming, and in other place cruciate anastomosis is forming. So transverse and cruciate anastomosis are important, and also giving some branch here in the lower part. This is saphenous artery. Okay, and descending genicular artery, and some branches which are forming anastomosis around the knee joint. And here it is branches of profunda femoris. So this is profunda femoris, direct branch from the femoral artery, largest branch from the femoral artery, giving the lateral circumflex femoral artery and the medial circumflex femoral artery. And these are the continuation of profunda femoris, giving the perforating arteries, and these are again dividing. It is medial circumflex femoral is dividing into two branches. It is dividing into three branches. Okay, and see here the perforating arteries reaching the back of the thigh after piercing through this adductor magnus. Okay, and they are again dividing into ascending and descending branches and forming a anastomotic chain. So this anastomotic chain you will see in back of thigh dissection. Okay, and here is the cruciate anastomosis formed by the two transverse branches from medial and lateral circumflex femoral, and from branch from inferior gluteal and first perforating artery. And here is trochanteric anastomosis. Okay, it is getting branch from superior gluteal artery and the ascending branches of these two circumflex femoral arteries. Okay, so these are important. And here saphenous opening have been shown here. Through the saphenous opening coming out to superficial branches of the femoral artery, superficial epigastric and the superficial external pudendal. And this is piercing the superficial circumflex ileus is piercing the femoral sheath laterally. And through this opening entering this great saphenous vein. Okay, this is important. If this junction there is a valve, okay, if the valve becomes incompetent then there will be varicose vein. Okay, 7 perforator veins are there. In which region this perforator veins become incompetent, there will be varicosities of the leg veins, because there is pooling of blood in the lower limb due to gravity, and the calf muscles act as the peripheral pump which pushes the blood upward. Okay, and here is the formation of femoral sheath. You can see anterior wall of the femoral sheath is formed by extension of this fossa transversalis, and posterior wall is formed by the fossa iliaca, which are pulled along with the femoral artery. Okay, and this is femoral branch of genitofemoral nerve. Here is the formation, and this is cribriform fossa which is covering the saphenous opening. Okay, and through the fine openings different superficial branches of artery, lymphatics are passing. Also the great saphenous vein is passing, and this is one peritoneal fossa due to formation of the femoral sheath, femoral fossa. Okay, and here are the nerve and the branches. See, these are the lumbar plexus, formation of lumbar plexus from T12 to L5. Nerves are taking part. Okay, and this is femoral nerve, which is a branch from the lumbar plexus. And here is the lateral femoral cutaneous nerve, lateral cutaneous nerve of the thigh. Okay. And you can see femoral nerve is entering the femoral triangle, then giving different branches. Okay. Okay, that's all. Any queries? Okay, so from anterior division of femoral nerve, two cutaneous branches, okay, medial and intermediate cutaneous nerve of the thigh, and one single muscular branch. Single muscular branch we supply the Sartorius. And from the posterior division, only one cutaneous branch, okay, saphenous nerve, are and other are the muscular branches. Muscular branches are supplying the quadriceps femoris, okay, for all 4 muscles. Rectus femoris, the 3 vasti, vastus medialis, vastus lateralis, vastus intermedius. Okay, so you remember the branches from anterior division and posterior division. Femoral nerve can individually come in your theory. Okay, so this topic is very important, today's topic for your theory. You prepare femoral triangle, its boundary content as a long question. Femoral artery, femoral vein, femoral nerve. All these you prepare as a short note. Okay. And femoral sheath you prepare as a theory, long question. Practice diagrams and all. Okay. And the clinical aspects, femoral hernia, coronary angiography, why femoral hernia is common in females comes in your explain why. All these you prepare for your theory questions. And these large structures are important for your OSPE practical. Okay.